I felt in a meditation in Sedona, and we were meditating to talk to the dragons. I felt a current of power come up through the earth. So I believe there are unseen things there. And for me, when I align myself, when I make an alliance with something bigger than I am, and in shamanism, we talk about power animals. When you align yourself with energies that are not exactly yours, but you get into an alliance with them, then you have access to those talents and abilities. And for me, that's the best way of reducing my fear, because I have helpers.
Welcome to Connecting with Coincidence. I am your host, Bernard Beitman, MD. Bernie is what I get to be called a lot. And we've been doing this show for a while, and it really helps when you subscribe to the show on YouTube and other places. It also helps to have messages from you. I really like responding to the comments many of you send us. And recognize that I got a book back here called called Meaningful Coincidences, How and Why Synchronicity and Serendipity Happen. I invite you to look at it and perhaps buy it. And today we'll have what I hope is an intriguing discussion. It's about the practice of Western medicine. And I think the practice of Western medicine is beginning to transform. Independently thinking physicians are finding shamanic healing practices that they can integrate with medical practice. For example, I am introducing synchronicity to primary care physicians and integrative medicine physicians. The thing about that is that they experience physicians in their practice synchronicities, but they don't recognize them enough to talk about them, but they can be useful in helping people to heal. Our guest today helps patients to tap into universal energies like power animals and ascended masters to promote personal healing in addition to the standard Western approaches. Dr. Sharon Martin is a physician and shamanic and energy healer. She quickly learned, faster than I did, that mainstream medicine was insufficient for eliciting deep, lasting health. Sharon now bridges the mystical with the scientific, with shamanism, energy medicine, and consciousness. She teaches how to live a life in balance in mind, body, and spirit. She also incorporates a new broadened perspective into her medical practice and into teaching others how to participate in their own healing. Welcome to Connecting with Coincidence, Sharon.
Thanks, Bernie. I'm so glad you invited me. Thank you.
Well, it was partly a result that we had of having a good time in our discussion on your show that we got to that. And I got a kick out of it. You didn't know that I thought a little bit more like you than you realized, and we figured that one out, and so we are compatible and comrades in this attempt to help medicine evolve itself.
And you want to know something exciting? I can't give the details yet because I'm not officially allowed to, but my podcast just won a national award for Best Alternative Podcast.
Congratulations, Sharon.
I know, it's pretty exciting.
That's wonderfully exciting. Why don't you, what's the name of your podcast?
Maximum Medicine.
Maximum Medicine. It has something to do with this book. There's a big
Yeah.
section in this book called Maximum Medicine. So what do you mean by maximum medicine?
Well, I've got to back up a little and talk about what I think is lacking. I'm a general physician. I'm an internal medicine physician. I work in rural South Central Pennsylvania. And there are times I'm academically well trained, and there are times when I can do everything by the book perfectly. The right medicine, the right treatment plan, the right according to mainstream medicine, and nothing budges. And the person does not change a bit. And so I started 20 years ago, I guess, looking at, well, how did the ancient healers, without x-rays, without prescriptions, without immunotherapies, how did they elicit healing? And I started to study it. And to me, when you incorporate what the ancients knew and you incorporate more of a spiritual aspect with mainstream medicine, then that's what I would call maximum.
And that's a broad territory for you to integrate. There's a lot of ideas about shamanic healing that you had to take you've had to look at. Um, so to give us some idea about what you do, I think it might be worthwhile, as you do in the latter part of your book, Maximize Your Healing Power, Sharon Martin, that we might address what you said and describe people can do about COVID-19 and other infections like those. But staying with that, with the viral infection, how can people use both modern medicine and the shamanistic ancients' views and practices to help themselves if and when they have an infection of COVID?
So to answer that, I'll have to just give you a few things that I think are fundamental to my understanding of what's going on in shamanism, because many cultures have shamanic indigenous healers. But when I looked at it, it doesn't matter what God you pray to. It doesn't matter if you use a rattle or a horn, or what I think is going on is the ability of the person to tap into what we in New Age call the universal field, the divine matrix, the transpersonal, to align yourself with something bigger than yourself. And that requires us going back to a better, deeper view of humans as an integral part of the earth and the universe. And I think we've lost that. So that's a fundamental belief. The other is that there are forces in the universe, the unseen world, that we can align with. And there are intelligences that are all around us that are unseen. The wisdom of trees, of plants, of nature spirits. And so having that ability to align yourself with forces bigger than you or outside of yourself also helps. And then probably the main thing is to shift your thinking into being able to set an intention and believe that you can be different. Because if you have not given yourself permission to heal mentally in your very being, you won't. You absolutely will not. And those are key components that I think exist outside of whether you're, look at Celtic or African or Mongolian or anything.
What prevents people from giving themselves permission to heal?
Fear, a belief, and this is when people are locked into I call it being locked in the cage of your beliefs. The idea that you are just like your mother, or, well, everybody in my family has this. You have to be willing to say, what if? What if I'm not? Why can't I be different? That takes courage to say, I could find a way through that isn't everything I see in front of me, but it is that not likely, but still possibility. You have to be able to allow yourself to step over to a different path and to see yourself differently. It helps if you're a good visualizer. It helps if you're able to meditate or to tap into your deepest part. It helps if you can get out of the craziness of your human mind and focus on your higher self or your value in the world. But if you don't allow yourself to see a different trajectory, things will never change.
If you don't allow yourself to see a different trajectory, things will never change, which goes directly to your emphasis on intention. And intention has has some different variables in it. And I have my ideas about that. But why don't you tell us what once you give up not having to be like good dear old dad in some disease or other psychological pattern, then you establish an intention to heal. Could you tell us what you mean by intention?
So, an intention is what I call when you are absolutely laser focused on what you want, and every part of your being has joined up on that wish or that desire. So, intention is your strong belief in seeing yourself, I'll use it in healing, seeing yourself differently. And intention has to be laser focused. I was talking to someone the other day about, so many times we say what we want, we wish for. And let's just take your job. You're so fed up with your job. And finally you say, I can't stand it anymore. I need to get out of this job. That's a very strong wish. But then what might happen is you get out of the job, but you land in one that really isn't any better. So a really good intention is to say, I want a new job, but to define the characteristics of it, to be really clear. And the way you do that, in the way I think of it, is you see yourself as your future self in what you think you want, and you feel into it. And if it doesn't feel right, then you have to amend your thinking. Because how many people have done what we say, be careful what you wish for? Because if you're a little bit sloppy in, oh, I've got to have this, well, maybe you didn't really want this. Maybe you wanted this with a little bit of a tweak. So intention is laser focused, being able to see yourself in the future and liking what you see. So you're going to adjust your intention to fit that. So not just I want a new job. No, maybe what you really want is financial security. Maybe what you really want is good teamwork people around you. Maybe you really want a boss who respects you. It might not be that you actually just want any new job. So you have to be really clear. And the same goes for healing. You have to see yourself as what you want. Just to say, well, I want to get rid of this knee pain. Well, you can get rid of the knee pain, but you're still not very good at flexibility or exercise. So maybe what you really are saying is, I want to be able to move better. I want to be able to be more flexible. So you have to really think it out. And the best way I think to do that is to see yourself in the future and see, well, if I get what I wish for, do I really want that?
Did you happen to want that award for your podcast?
Uh-huh. I wanted to get my work out there and have it recognized. So yes, I didn't expect the award. Somebody nominated me. I didn't even know about it. But if it helps me get, like you, Bernie, if it helps us get the message out there that mainstream medicine needs to change, then yes, I've been wanting that for a long time.
Yeah, and this award becomes one way of helping that to happen.
Mhm.
It wasn't necessarily that you imagined it, but it's a step towards what you are imagining to influence
Right.
mainstream medicine. And I think that's important to recognize that you may be getting what you want or in the direction you want, but there are steps there that you didn't think of. And that's part of the whole process to be able to accept that's how it works. So that's
We were always taught I trained with the Four Winds Society, which is a shamanic educational in shamanism in the Peruvian tradition. And we were taught about when you put it over to spirit. Now everything has a spiritual focus. You don't have to believe in God or spirit to do this, but um, leave the details up to spirit. So it may not look exactly like you wanted. And that's why you want to say the things you want, say about a new job or about your health. You want the financial security, you want the respect, you want good coworkers, not just, oh, I've got to get out of here and I got to make more money. Or with your knee pain, not just relieve the pain, because what if you're still not fit and you don't get to walk much anyway? So I think that's leave the details up to spirit. Um,
but make sure that you have a rich, full outcome in mind. And that's what you keep saying, is you need to have the outcome clearly delineated and how you get there. Knee pain reduction is one part of it, but it's much more than that. I'm going to tell you a story of a friend of mine who went to Burning Man and loved to dance. And it, as he was dancing one time, this big guy stomped on his foot and broke a bone in his foot. Now, this is early on in the Burning Man time, and he was hobbling around and had to go to the medic there, and they said, "Yeah, you broke your foot." And they gave him some crutches. He had a bicycle, and he just wanted to dance. So he figured out ways to ride his bicycle with one foot and participate in the dancing. And then after a while, he started talking to his foot and saying, "Don't you want to dance? Don't you want to dance? Don't you want to get out there and dance?" So he would use his bicycle as part of the dance with other people, but then
mhm,
he'd get off the bike and after a while was starting to be able to dance with people, and then he'd stop dancing and his foot would hurt. And that went on for a while. And after a while, he was dancing a couple of days later in the way that he wanted to. He wanted to dance and he got his foot to heal. And
mhm,
this was a remarkable story. And you've probably heard them. It's knee pain is one thing, but a broken foot is another. And
mhm.
he was out there dancing after a couple of days because he was so determined to have the fun of dancing at Burning Man.
So I'll tell you a story of a patient of mine. She had some lymph nodes in her neck, and ultrasound or x-rays showed swollen lymph nodes. She went to a cancer doctor who said, well, you have lymphoma, but it's one of these slow growing types, so not to worry. In other words, when the doctor says smoldering, it means, this is going to burn on for a long time, but don't worry, you're not going to die next year. She wanted none of that. She wanted absolutely none of that. And she came to me and said, I'm going up to such and such a place, a bigger center. And of course, I thought she was denying and that she didn't need to go because I believed what the oncologist had said. I thought he's the expert. I'm going to, okay. But she went, she got there, and they said, well, did you ever have a biopsy? And she said, no. I said, well, we're going to biopsy this. Well, it turned out to be sarcoid, which is an autoimmune condition, not cancer. And it went quiet after a year, and she's totally unbothered by it. So, well, we could talk about the errors in mainstream medicine in that, but what she did was say no. Her intention was not to go down the path that led to a cancer, however slow growing. She said no and went elsewhere. So she took action to follow her belief and ended up with something completely different.
You know, my own experience with mainstream medicine, particularly with cardiology, is how they love to frighten me.
Mhm. I can't stand that. I think we've gotten away from recognizing the power of your words. I have somebody who had abnormal blood count and went to a hematologist and was told, oh my God, this is myelodysplastic, which is, it's fatal. Myelodysplastic, and if you make it a year. But they said, let's do a bone marrow biopsy, and it came back to be an immune attack on the platelets. Well, how do you dare say to somebody, this is a death sentence, when you haven't even done the tests? And even if you did the tests and it showed myelodysplastic, how about, this is going to be rough, but I'll be with you every step of the way. And let's do whatever we can to keep this from affecting you. I mean, the power of words, you know that, Bernie. It's just, and we're so cavalier with throwing diagnoses around. We forget about the impact on the person's emotions and psyche.
Yes. Andrew Weil tells the story of a patient with early multiple sclerosis, just by examining some of the images of her brain. And he goes outside the examining room and comes back in again with a wheelchair and says, this is your future.
That's cruel.
That's cruel. He called it hexing. It's cruel. It's very cruel. I had a relatively slow heartbeat. I'm an athlete, so it gets slow anyway, but it was about 40, 45 for a little while. It gets down to 45 sometimes. But it was 40 and lower when I was on a beta blocker, which makes your heart go slower. So the guy says, cardiologist says, go, you need to have a pacemaker put in. So go get a pacemaker evaluation next Monday morning, like 2 days from now, and like it was an emergency. So I show up Monday morning, and I'm not good in the morning, especially Monday morning. And they start, the nurse takes my blood pressure, and my systolic is 190. My body is saying, I don't want anything to do with this. And of course, I don't have a pacemaker in now. That was my body's reaction, but it was a terrible thing for him to like suggest this as an emergency thing to scare me. And that continues to happen in cardiology, from what I can tell, where they're so tuned in to the negative and see some small probabilities as going to happen that they scare patients like me into submission to doing the procedure that gets them some money.
Well, I've tried over the years to learn. I can see something that could happen if the person goes along with how they're living, especially with diabetes, completely uncontrolled. And I can see bad things down the road. But if I'll say to the person, I really think you ought to do this. And they say, I don't want to. I said, okay, that's completely your choice, but let me tell you what I worry about and what I don't want to happen to you. And these are the things that could happen. So here's 3 options. We don't do anything. Is there something you're willing to do? Or do we go, whole hog on mainstream treatments? I try to at least say, here are 3 ways we could go. Let me tell you why I'm nervous and why I'd like you to pick at least something. And people may not listen the first time around, but I'll tell you a story. I had a man, he was probably in his early 50s when I first met him. He was a type 1 diabetic, which means he needed insulin to survive. And a lot of times he would have uncontrolled high sugar, and a lot of times he'd take his insulin and go hiking, and his sugar would go really low, which is life-threatening and dangerous. And I would pester him for literally 10 years to consider getting an insulin pump. And this was back before we had the monitors that measure your blood sugar all the time. And he didn't want to do it. And I recognized that I kept harping on him. I was really kind of like a little medical policeman, which is really not a good way to be. And so I was working on giving up that kind of approach. And all of a sudden, one day he said to me, he said, I want to get an insulin pump. I was shocked. No more low sugars while he hiked, because he had the meter and the pump that adjusted that, so he didn't go low when he exercised. No more really high sugars, because it adjusted to give him more insulin when he needed it. Best treatment of his diabetes I had seen in 10 years. So I would say, don't give up, because even if you don't do it now, doesn't mean it's not simmering in there, nudging you that you'll do it another time.
Well, that's being a good standard medicine person, what you just described. I think what's most important about what you offer is the story is related to the story of the guy with the broken foot and the intention, because here was a case where intention made a big difference where mainstream medicine would not have believed it. And so it's important to be able to do what you talk about in your book, is to tap into the universal field for treatments. Insulin pump's a great idea. You gave him choices, but that's medicine, regular medicine.
Mm-hmm.
What you are bringing and what I'm hoping to bring is that there are more forces, energies, plants, nature, and also hidden masters, ascended masters, and other entities in the universal field that can help people. This is what you're bringing. That's
Mm-hmm.
beyond your good practice of standard medicine with the insulin pump, and that's what I think our audience would most benefit from.
Well, let's go back to your person with multiple sclerosis. Well, forget about the cruelty of the wheelchair. Multiple sclerosis is an autoimmune attack on your nervous system. So how would you use the unseen approach or the shamanic approach to healing that? Again, you have to believe that there's a possibility that you can heal it. Even if you admit it's only a possibility, you have to believe in it. So be as aware as you can about your diagnosis in all ways, in the ways it affects you, not about things that the doctor tells you, but how afraid are you, how you see the future. Just get as clear as you can. And I talk about this in my book as the medicine wheel of interactions. I call it the 4 A's. So you be aware. But then this is the step I think is the biggest step, that you allow. This is the permission to heal step. This is allowing help from forces outside yourself. We have a life force running through us that is aiming for the healed outcome. Every one of our cells is geared to be a healed, operating like a smooth machine. So we have to find ways to, within ourselves, to encourage that optimum functioning. And to me, the way you do it is in things like meditation, prayer, quiet time, visualization, where you tap into the possibilities of how the life force is going to run through you and how to bring that to bear instead of staying in the fear and the everything you see right in front of you, because that we are a world of possibility. You don't have to stick with just what you see in front of you. And in that allowing, to me, the kind of healing that I would teach has a very strong spiritual component, because I believe there are forces outside ourselves. We call them angels, we call them Mother Mary, ascended masters. If you're, you talk about the Buddhist gods, you talk about the nature spirits. You can even do the elements if you're Chinese medicine and you see the power of the elements. All of those things exist in the universal consciousness, the transpersonal, but they all can, and we talk about it in shamanic work as energetic, they can all come together to give you, the ordinary human struggling with this disease, give you extra power. So you've got to allow that in. You've got to allow help to come from all these different sources, even if it's just from your own higher power. And then the rest of the medicine wheel is you take action on it. And but that allowing, that permission to heal, that ability to tap into the unseen world where there's unbelievable power, to access that and align yourself with it and make an alliance is really a big deal.
It's so important what you're saying, Sharon. The first step, again, to repeat it, is to allow the possibility of having a change in the direction that you so very much want.
Mm-hmm.
And the reason I brought up that cardiology pacemaker example is because medicine and the wheelchair multiple sclerosis frightens people. They are remarkably intent, many mainstream physicians, on scaring patients into doing what they think the physician thinks is the right thing to do.
Mm-hmm.
And they do that sometimes with an economic imperative to get, as in with the pacemaker, is to get another instrument, another procedure done. And sometimes it's just the way they're trained to think about the worst outcome. Look for the pathology. When you do a differential diagnosis, you want to do the whole list, including the uncommon but possible outcomes that are pretty bad. So the first
But
thing,
that's true. We're trained that way. And unfortunately, I think it is reinforced because admit it, we all operate under the fear of missing something,
yes,
or the fear if we don't do something, then they're going to sue us.
yes,
So here you've got that vicious cycle where you've got to keep offering high tech and keep pushing the person to do something so you can say you did it, so you're not accused of missing something.
yes,
Um,
very
it,
important point about what drives physicians. Yes.
which is really, that is not healing. That is not what I would label as healing. That is a fear-based,
Yes.
yeah.
Yes. And I think what we're talking about here is something I hadn't clearly recognized, is how physicians are driven by the fear of a lawsuit, a fear of missing something, a fear of being accused of not being thorough. So fear
Or
drive
of being stupid by
of being
not seeing it.
being stupid,
Mhm.
being very important, fear of being called stupid. So now you're giving me a better sense for the fear with this cardiology and the pacemaker. My insurance wouldn't have paid for it because I didn't have any fainting symptoms, which is what they needed to be able to pay for it. So they were overdoing it yet further, just maybe prevention of prevention. But the drip, it's so important what we've got here, Sharon, that we have been taught to be afraid as physicians, and we convey that to our patients.
Mhm.
And the wheelchair is just a full blown illustration, a wheelchair with multiple sclerosis, of going
Mhm.
beyond that. That he didn't have to pull that wheelchair out. And that wheelchair example, as well as the foot once I'm bringing it that healed, illustrates so clearly what you're talking about is that you have to overcome the fear of the negative outcome, which is in you anyway, and then is reinforced by the physician, and then believe, as the broken foot guy did, that I can do something. I want to dance. It seems to me such an important message from you.
Well, I think we can even extend it to talking about COVID.
Go, please.
COVID hit, at least in my world, late February 2020, early March. And of course, it was first recognized, I think, in December of 2019. Um, I was petrified. Everything in the media made me petrified. And then that fear was reinforced. I didn't know, is the gown I put on and the mask I put on and the gloves I wear going to be enough? Is this thing like some creepy Ebola that I'm going to like get, it's going to infect me and I'm going to keel over? I was petrified. And then on top of it, I actually had patients in their early 50s with horrible consequences from it. Some died. One woman had blood clots in her lung, coughed so hard she tore holes in her diaphragm and had to have open chest surgery. Just horrible stuff. And it was surrounded, of course, we all know the media doesn't help us there. But I lived easily for 2.5 years in fear, and our patients lived in fear. Is it any wonder they say, which they do, I refuse to let you test me, or I'm not going to get that vaccine because there's all the fears about the vaccine, because they're sick of being in a world where everything you turn around and there's a boogeyman in every corner. They're sick of it. And so they just as soon be in denial. That's a hard balance, because as soon as you get tested, you say that it's possible you're going to get it and you don't want to face it. As soon as you agree to wear the mask, you agree that there's a boogeyman waiting for you outside, just around any corner of any grocery store. We've lived in the past 3 years in a world of fear. It's terrible.
Well, some of it's realistic. In your
Yes.
in your book, you again, in what you're saying to people is that we've got to get past the fear that has a realistic base. And I'm very curious to hear you talk about how you manage fear with a positive intention regarding COVID.
I have to take it back to my spiritual philosophy, and that is that I'm not alone, that there are forces bigger than me in the unseen world, whether I call it God, whether I call it nature spirits, and they have energetic frequencies. There are things you can feel. I felt in a meditation in Sedona, and we were meditating to talk to the dragons. I felt a current of power come up through the earth. So I believe there are unseen things there. And for me, when I align myself, when I make an alliance with something bigger than I am, and in shamanism, we talk about power animals. When you align yourself with energies that are not exactly yours, but you get into an alliance with them, then you have access to those talents and abilities. And for me, that's the best way of reducing my fear because I have helpers. I have every morning when I drive to work in the dark in rural Pennsylvania and the deer cross the road, I intend with the story I tell myself in my head, I ask the jaguars and the dragons to get on either side to keep the deer back. No harm, no foul, nobody gets hurt. And I intend that my drive to work will be safe. But there's beauty in those alliances. For me, it gave me faith in the future. It gave me faith in my ability to work within any adverse circumstance. And it's amplified for me in meditation. When I do enough quiet time to float inside that universal field, that void, that divine matrix, whatever you want to call it, and recognize that I am part of a bigger picture, I feel more secure. I feel more capable of choosing a future that may look different than the one I'm standing in right now. So I think for me, that's what shamanism taught me is the unseen forces that surround me, to ally myself with nature the way the indigenous did. Everybody can relate to feeling good around trees. Trees have a wisdom. They've been on this earth millions and millions of years before we ever showed up. Everybody can relate to feeling the beauty of a meadow of flowers. And when you align yourself with nature, you are literally energetically diffusing your short circuits and resonating with something bigger than yourself, something stable, something long lasting, something wise. So that's how shamanism helped me.
And that's how shamanism can help other people. And there are two general elements to what you're describing that I'd like to summarize to see what you think. One is the general universal field, however we call it, whatever you call it. And within that universal field are energetic entities that, and here's the key part of it, that you, I, all of us can align ourselves with. As you're riding down the road trying to have no deer run in front of you, as someone who has an illness might want to be able to align with those forces to imagine a normal outcome, an outcome of being normal rather than somehow having pathology. So you align with those elements. My elements are the forest near here, and particularly 3 trees that love for me to sing to them, but who have been very helpful to me in a lot of different ways over the last decade. I love them, and they love me, and it's a wonderful experience to be with them. So those are, I have to go there this Saturday. I miss them, and and each of us has a probably different energy beings to resonate with that are close to us. They're not the same as us. I'm like a tree. I'm also like a fish, and I can relate to those energies. And finding what those energies are and what names you give to them can be important so you can find them again. But being able to create the alliance and believe there is help in the alliance, that's what Sharon Martin is teaching.
Thank you for that, Bernie. You know what else is, even if you align yourself in your prayer time, your meditation time with the original template of how your cells are to work, because there is intelligence in every cellular, every biochemical, every molecule of your body. And it was designed, I don't know by whom, let's call it source, to work correctly and to work in a healthy function. So once you align yourself with that and feel it reinforming your current body, you can shift to the healed state.
Align with the original template, connect with energy beings in the universal field, feel part of the oneness of the universal field, so that
Yes.
you're not alone. Seem to be
Yes.
three parts now of what you're saying
Mm-hmm.
can help people.
That's a good summary. Yep.
That's a good summary.
Mm-hmm.
Well, I really appreciate your repetition of the original template, because there is a, a drive towards wholeness of each of our bodies, each of the cells in our
Mm-hmm.
bodies. I think that's true of humanity too, that there is a drive towards wholeness for humanity as part of nature, and being
Mm-hmm.
integrated with itself, which I see synchronicity awareness being helpful in helping people see that and participate in it. And you're indirectly, oh, well, or directly, we're doing the same thing. I think of something called the collective human organism, where each of us is a cell in this collective human organism, and each cell has a function, just as you were talking about in the individual. And we got to find that function, the original template that we're here to do, our purpose here, and then join others, both as individuals, as cells in our body has to do, and as part of the collective body, to help this whole organism become whole again, to become more
How
what
to
it can be.
thrive,
Pardon me?
how to thrive and get through our challenges.
How to thrive and get through our challenges.
Yeah.
Well, I think it's so important, at least I think for our audience and for people beyond it, to hear what you're saying about healing yourself. Um, and I just the three steps that I come up with. So, um, if one of the things about COVID um, is that if you wear a mask, you are saying there is a boogeyman out there. There is something scary out there.
Mm-hmm.
And having the mask on yourself can make you afraid,
Mm-hmm.
because there's a feedback loop. Rather than recognizing the mask as an aid, uh, when you go out into the world, like traveling on airplanes and stuff, uh, you can say this mask means I'm afraid and I've got to worry that somebody's going to get me.
Right.
Well, I hadn't had any COVID for 3 years, and I went on a trip, a short trip, and I was nervous about getting it, and I got it. And it was very short, up to Boston from Charlottesville. And I began to think that there's something about being afraid that helps the virus get into us, just like with dogs. If you show them that you're afraid, they'll come after you. If you just say, "Hi, Charlie, how's life?" They start wagging their tail and maybe doing a little sniffing. What do you think of that?
I think that there's a possibility when you're afraid your immune system goes down. But you also have to recognize, and there's a whole different conversation, that your thoughts direct your outcome. So if you're thinking, I'm going to get it, that's a form of manifestation.
It is.
So,
And if you're worried you're going to get it, it's still a form of manifestation.
yeah.
Yeah,
Mm-hmm.
it's a lot about what you think about. It has
Yeah. Yeah. Mhm.
Well, what do you think about our conversation today, Sharon?
I had a good time. Thank you for inviting me.
Yeah, you're welcome. And as we get close to the end, we have a bit of time left, and I want to see what else you might want to say to our audience that we haven't gotten to.
Align yourself with something bigger. And I can't say strongly enough the power of nature. Humans can't exist without the earth. I mean, we do not exist without this planet. Sure, we could send people to the moon, maybe even send people to Mars. I don't know, live on a space station. But we are energetic beings, and our energies resonate with the earth. We are meant to be one with the earth, and we have to recognize that more and more in our daily life. You can use nature as a form of healing because it does calm your whole energetic and electrical system down. And there's wisdom. There's wisdom in the seasons and the rhythms of growth. And that helps you remember that you're a piece of the bigger picture. And I think those are all good things.
They are all good things. And as we get to closing, I want to tell you about a relationship I have with the moon. Uh, the the moon sometimes speaks to me, and the moon also shines on someone that I love very much, we're not in the same place. Even if she's a mile away, she's not in the same place. And there's something about the moonlight that connects, that I feel connects us. And she wants you to describe that the moon, the moonlight serenaded her to sleep,
Mhm.
which was a lovely image. And I then sang back to her on text, I see the moon sees me, hiding among the tall oak trees. Please let the light that shines on me shine on the one I love. So that
Mhm.
the moonlight connected us. What do you
That's
think?
beautiful. Well, the other thing that I can think of is the lunar is the feminine, the emotional, the intuitive. So it makes sense that you're connecting through moonbeams when you think about those subtle energies that connect you and thoughts that connect you. So, yeah, it's perfect.
Beautiful, beautiful. Well, the book, Maximize Your Healing Power. Our guest, Sharon Martin, the author, Sharon Martin. And just to summarize, we're all part of a oneness to connect with. There are energy beings that we can call on. You got to ask. That's the thing
Mhm.
about this. You got to ask. It's so important to ask. You got to ask these beings to be part of you. And for me, it's trees, and now more recently, moonlight, and just the moon itself. And these beings are there for. Why they're interested in us is another question. Why they want to help us is another question. But we can make our guess about that. But they are there. And remember that you have a template. Your body has a template of wholeness and wants not only to get back to that, but to maintain that. And those are three major contributions from Dr. Sharon Martin, um, allopathic physician and shamanic healer. And Sharon, thank you very, very much for joining me today. And it was a pleasure to connect with you once again.
Thank you, Bernie. Thanks so much for this conversation. It's been fun.
You're welcome.
This psychosphere is our mental atmosphere, like a hologram of cosmic consciousness.